I want to thank everyone for joining this session. I know it's kind of later in the evening, so I do appreciate it. But yeah, so essentially this is a session about searching the evidence, particularly focused on the literature search, but applying a more intersectional type of lens to it, particularly in response to issues of health disparities across race, gender, social class, sexuality, and I can go on with those, with all the plethora of different identities that we all carry, and that all shape our lived experiences. And we'll talk more about what intersectionality is. Kind of do a brief introduction to it. But yeah, and during the course of this, feel free at any time to put anything into the comments. You can feel free to unmute yourself at any time. Essentially, I kind of like to have this as also kind of a space for conversation as well, especially since this issue or this particular topic is fairly emerging in healthcare and medicine, especially with intersectionality. So yeah, I'm always happy to hear people's thoughts, feedback, comments, perspectives, and also just to also acknowledge the fact that, even though I'm presenting this, is that I'm only presenting a particular side, especially because it's shaped by my own lived experiences. Just to acknowledge that, being white, being cisgender male, being heterosexual, having a full-time job with employment benefits and such, they all serve to influence the way I can access certain services and other types of resources. And yeah, it can ultimately shape my perspective. And this is kind of like, I like to have it more as a starting point. If this is your first time kind of touching on this type of topic. And also for the fact that a lot of this topic doesn't, there's been a greater discussion about this and how it affects evidence-based practice and research practices. But what I kind of identified too was that it doesn't necessarily touch on too much with the literature search in particular. So as a librarian, I wanted to kind of provide that kind of coverage about that particular area, because it's such an important and often understated role in both research and in the clinic when it comes to finding evidence to inform your practice. So yeah, so for the agenda is basically to discuss what is intersectionality and why it matters, especially within this context of research and healthcare. And then ultimately talking about different strategies that you can actually apply to your own research or to your own search of the literature. And then concluding with a couple demonstrations, or at least a couple looks into a variety of health equity tools that I've kind of identified as to assist with your own search with the literature. So yeah, we'll go ahead with that. And yeah, thank you. Yeah, I definitely want to contextualize this because it's such an important topic. And, fortunately, our university is really wanting to focus in on that. So yeah, this is kind of like my way of trying to contribute to that. So we'll go ahead and move on to this. So you probably did see at the top of the presentation where it has go to www.menti.com. And use the code that's provided. Feel free, if you're able to enter that into your browser. I think even if you are using on the phone as well, you can do that as well. I can say what the code is if you want to do that. The code is 41450718. So yeah, feel free. And yeah, basically I have a question here as to what are your preferred resources for finding evidence? And basically I wanted to kind of have this as an opening of just seeing what are your default ways of searching the evidence. Like if you were to do to start a search through the literature, how would you go about it? Like what resources would you immediately start trying to use? I'll give it like a minute that way people can have some time. Yeah, USA Library Open Search. Yep. So yeah, I imagine that's referring to the Search USA search engine that we have. PubMed, the library, Google. Yeah, definitely. These are probably my main ones too if I were to do any type of health sciences type of literature searching. Search USA. Yep, definitely. Great. Yeah, so I mean, like as this kind of shows, these are kind of the default resources that often clinicians and health practitioners and health researchers tend to start with, at least according to my look into the literature, is they tend to look at PubMed is definitely a popular database to explore, and it definitely makes sense considering it's specifically oriented towards the literature in medical and life sciences. Um, with Search USA, I mean, it's such a comprehensive search engine that allows you to access most of our databases simultaneously. So you can do as comprehensive a search as you can with the ones that we have available, since we have, from my last count, I believe 40 plus databases available to you. So, and yeah, and then Google, yeah. Even though it's actually really interesting that, you know, with the practice of evidence-based practice, you know, the emphasis on using databases, specifically scholarly databases to look into. Actually, the literature has been showing that clinicians, for the most part, tend to use Google as one of their primary tools for searching the literature, which isn't also surprising given the fact that there are paywalls and other types of subscription costs that can be associated with most scholarly databases, which might prevent you from actually accessing them unless you had some type of institutionalized access through, say, the university library or through your own employer. So Google, being the way it is super accessible in comparison, but there can be issues with it, and we'll kind of touch on that a little bit, even though that's not the focus for this particular session, but it's something I'm also interested in talking about all the time. So yeah, can always have a conversation as well about that. So yeah, I have another particular question here as well, is how confident are you in finding evidence about marginalized patients, and particularly using the resources that you just illustrated as well? So I'm just kind of curious, what kind of Big Lebowski are you in particular? Somewhat. Mm-hmm. Okay. Looks like, I think there was like, yeah, 3 responses and they all seem to be centered around 100%. Yeah, definitely no surprise that, especially given who we have in this session, being faculty and actual like practicing clinicians, not surprised at all that you definitely have some skill or knowledge of how to actually find that type of information. But yeah, but I'm also not surprised that it's not most of the time or always in those categories, mainly because it's not necessarily always just about your own personal knowledge or skill. It's also about the resources that you're using and how equipped are they to actually identify that kind of information for you to, or at least make it more easily locatable so you can actually access it. So yeah, definitely not surprised, and you know, that's kind of part of the reason why I want to do a session like this, is talking about that very reason, is like increasing that confidence in finding evidence, not only in terms of your knowledge and skill, but also in the array of tools that you have available to you. Great. So yeah, I just wanted to also contextualize again just a little bit more about why it actually matters in terms of practicing inclusivity and intersectionality, which again we'll kind of define a little bit more. But essentially also kind of connecting back to your responses in the previous slides, is that when I was talking about, it's not just about your knowledge and skill in finding information about marginalized populations and communities. It's also, there's systemic issues embedded in healthcare and particularly in health research that might contribute to that. Particularly, as the first point kind of shows, is that most clinicians are finding and using evidence from research based on a predominantly white and male population. It's fairly homogeneous in terms of sampling in the health research arenas. There's a bunch of different issues that come about, particularly if we're talking about clinical trials and their ease of access for underrepresented populations across race, across gender and such, mainly because there are a host of different issues to be regarded, such as financial limitations for participants of color or women or trans to actually participate. There also is issues of representation within the health research team as well. You know, particularly there's been research that's been cited around how, you know, participants who are underserved or otherwise marginalized typically have, or not typically, but they often will have a sense of mistrust towards medical authorities and experts. And that's not necessarily unjustified given the historical and contemporary issues of healthcare disparities, you know, barriers to access. Even if we're talking about research in terms of like the Tuskegee experiment in particular, those type of research practices have been particularly harsh on people of color, on LGBTQIA populations and so on. So yeah, that's definitely a greater discussion that is needed, but it is a issue that also influences your search of the literature in terms of how it represents those marginalized populations, and particularly how it privileges certain groups, namely white and male and cisgender male in particular too. And then, yeah, as a result, as the United States population becomes increasingly diverse, this approach to the evidence can definitely exclude certain populations, namely BIPOC, LGBTQIA+, from fully benefiting from clinical intervention, even when they're able to access it. So this can definitely influence how evidence-based practice actually works. Like, even though that is the ideal, is that your practice is informed by the evidence, but what kind of evidence is it, and who is it representing in particular? Yeah, and then the last part, yeah, even though we'll touch on this a bit, the last point here is that search engines, particularly like Google and other, you know, basic internet search engines, such as Bing, Yahoo, anything like that, as well as scholarly databases, have built-in biases that could affect your yield of inclusive search results. And we'll talk about that in a bit, a little bit more in depth. But at this point, I kind of wanted to pause just to see if there was any comments, any questions as we go along. It could be something that maybe I'll address in a bit, but I'd be definitely interested to see if there's any thoughts immediately percolating.
I just wanted to make a comment, Matthew. I
Sure.
really like the way you're introducing all of this, because one of the things that I've been kind of thinking about too is just the process for getting papers published,
Oh, yeah.
and and what and how much control publisher, or you know, just the editors of the journal have
Mm-hmm.
with rewrites of articles too.
Definitely. Yeah, I know there's been a lot of different issues with that actually, even if it's not even to do with like journal articles, but even like conference presentations and such. Yeah, there have been issues that have been coming out regarding how, you know, the editing hand, and particularly like who's actually editing that kind of content, and particularly those voices are being edited and potentially being edited out. Yeah.
Yeah,
So,
I'm kind of curious about that as well. So
mhm.
um, carry on, but I just wanted to make that comment as you're talking about the research being this way, and
Mhm.
just kind of thinking about the editing process, because I know in when I've worked on a paper with others, they were really cognizant of what the editors would want to see.
Right. Yeah, totally. And it also speaks to like, the representation within those publishing entities, and such, like, particularly their uh, perspectives that they are focusing on or prioritizing, for sure. Definitely.
Yeah.
And it actually kind of makes me think about the conversations that are being had regarding research, internationally, in terms of particularly one of the points I'll kind of raise a little bit is about the researchers in and from the global south, which is basically, I'll define it in a bit, but essentially is a collective of limited resourced countries and communities and populations across the world that have disparities in their access to research. Even as researchers and as practitioners, they have their own systemic barriers that are kind of preventing them from really participating in scholarly communications,
Yeah.
just like you're talking about, for sure.
Interesting. Yeah. Thank you.
Of course. But yeah, so we'll go on with, okay, so with this contextualization and regarding the multifaceted issues that are coming about when it comes to racial representation, gender representation, and social class, and so on, basically it comes to call for a need for a theoretical lens, or at least even a practical lens that we can actually apply to really reveal those different types of dynamics and those type of barriers and those type of disparities, and not necessarily focus on, as this quote will talk about, as like just a race problem or just a gender problem. So in particular, intersectionality is kind of that response. It was first coined in 1989 by a activist and as well as a legal scholar, Kimberly Crenshaw. Basically, this lens kind of emerged in response to Kimberly Crenshaw's analysis of legal barriers for Black women in particular, because back in like 1989, she was particularly investigating how Black women in hiring and firing practices and the inequities that came about that, courts would often only treat those type of cases as either a gender issue or a discrimination issue or a racial discrimination issue. They did not have the perspective to actually see that those two problems actually intersected, particularly for Black women, that their experience was far different from Black men and far different from white women. So it wasn't just a race problem, it wasn't just a gender problem, it was an intersection of those problems. So yeah, basically I kind of like this quote a lot about what intersectionality is, and it's quoted directly from Kimberly Crenshaw, is that intersectionality is a lens through which you can see where power comes and collides, where it interlocks and intersects. It's not simply that there's a race problem here, a gender problem here, and a class or LGBTQ problem there. Many times that framework erases what happens to people who are subject to all of these things. So as I kind of was alluding to, is that even for myself, I have many overlapping multiple identities that shape my lived experience when it comes to being white, when it comes to being heterosexual, when it comes to being cisgender male. Those don't necessarily operate in a vacuum by themselves or isolated from each other. They're deeply entangled with each other. So it's hard to try to analyze those issues again in that sense of a vacuum, that you can't just easily detangle them and dissect them that way. So as a result, we're all subject to overlapping experiences when it comes to privilege as well as to disempowerment. So we might have sites of privilege for us in the sense of like what we can access, but there can be other times when we're, depending on our racial identity, our ethnicity even, or gender, that could also be a site for disempowerment. So you can have multiple privileges as well as multiple disempowerments. So as a result, it's important to consider how race, class, gender, sexuality, and more intersect to reproduce these type of systemic disparities. So like I was kind of earlier mentioning too, is that for Kimberly Crenshaw, when she first introduced intersectionality as a lens, it was originally more focused in terms of critical law, but has since like emerged as a more interdisciplinary or multidisciplinary phenomenon, where it's now, you can now see it in education, you can see it in business, and definitely more recently, you can definitely see it in medicine and healthcare. Because as we are, coming to terms is that, racism, homophobia, transphobia, colonialism, and other inequities are not only present in our personal spheres, our personal lives, when it comes to like, say prejudice or behavioral patterns of hate, but it also manifests in the routines and policies of institutions, and particularly with healthcare, that can definitely be one side of that. And there's, like we've been kind of talking about too, is that there are many examples that exist and pervade both medical research as well as clinical practice that systematically exclude and bar certain populations and groups and communities and individuals from really accessing and fully benefiting from medicine, and from particularly evidence-based practice. But yeah, just to conclude is that, even though I've mentioned, social class and race and gender, the idea with intersectionality is that can easily go beyond that. Under this framework, you can also include other identities and social statuses, such as nationality, religion, language, and in particular disability is even another side of that. Immigration status, education. So yeah, it's definitely a very useful tool for really analyzing and examining those issues. Even as Kimberly Crenshaw says, though, that this is really not supposed to be the one-all be-all solution to really seeing how these problems interrelate and how they intersect with each other. She's always said that if there was a better theory that comes along, that could easily replace intersectionality. But for the time being, this is something that we should definitely consider really critically and should pursue when we can. So yeah. With that, even though intersectionality by itself can be very theoretical in nature, in terms of how do you actually apply this in your own practice. So I have a couple of suggestions here based on my look at the literature, even through library sciences. They actually demonstrate a lot of this as well. But actually there's been a lot of these type of recommended practices in particularly with medicine and healthcare and evidence-based practice. And I'll kind of go through some of these as well. And I think some of them actually kind of relate to some of the comments that were actually made very early on. But yeah, so first thing I wanted to consider was as a search strategy, whenever you're looking through the literature in particular, is to really consider the scholarly literature of the Global South. And just to, again, define what exactly is the Global South, or what it is I'm actually referring to. It's basically a new type of terminology that's kind of stemmed from the last, I believe, 10 years. Basically to kind of replace older terminology, or at least more problematic terminology when it comes to phrases like third world or developing country. Basically because a lot of those terms tend to have very ethnocentric comparisons or lenses. Because obviously if it's developing or third world, something else has to be first world. So what is the standard being compared to? And is that really a equitable representation of that? But yeah, so the Global South is again referring to a collective of resource limited nations. And this can even include communities within those nations and groups across Africa, across, even though I say Southeast Asia, it can easily go into other areas of Asia, the Americas, and some parts of Europe as well. So basically, kind of what I was alluding to before was that the Global South in particular has had quite a few issues when it comes to, or quite a few systemic issues when it comes to being able to access and being able to produce research, mainly because they either, like researchers there will often lack the infrastructure when it comes to like funding, when it comes to opportunities to actually present their research at conferences or even just to publish as well. Namely too is there, as an example too, is language, particularly because a lot of scholarly journals, particularly the more prestigious, tend to have selection criteria for English written publications. And so that can be also posed as a barrier because even though like technically they could try to hire a translator, the idea of trying to hire a translator that not only can translate into English, but also be able to translate like often heavily jargoned terminology that's often like located in academia or your specific field, can be really difficult, to say the least. So yeah, and then there's also been an ongoing issue when it comes to practitioners and to researchers who have a tendency, particularly if they're located in the global north, which is basically like the United States would be one example of the global north, is that they tend to prefer literature published within the global north, or particularly within their home countries. But this can limit your evidence-based practice as you overlook the scholarly knowledge being produced around the rest of the world. Because again, it's assuming that the United States, as well as other countries in the global north, are the leading examples of evidence-based practice, when that's not necessarily the case in some ways, particularly if we consider that there might be health conditions, there might be therapeutic interventions being more utilized in certain parts of the world, and as a result, they might have more research regarding it. So yeah, so that's one thing to consider. So, you know, when you look at the literature, even though it may be applicable to look at populations that are within your country, maybe because that's where your practice is or where your research is mainly centered, it is also important to consider the scholarly literature and what it's being written elsewhere as well. Another point I like to add is to learn about systemic bias in scholarly databases in internet search engines. This is easily another type of workshop that I actually like to do a lot, particularly about systemic bias in scholarly databases and internet search engines. So I won't go too much into this, but if you're ever interested, I do offer a different workshop on this. Is that these, like particularly internet search engines, have algorithms embedded in them in terms of that base around your search behavior as well as your personal preferences, such as like your search history, your location even. Like there's actually been cited examples of how internet search engines will base their results around your location. Particularly, and as a result, again, if you were to do, because of that, the global south literature might be less visible and less accessible as a result. Even scholarly databases can have their own types of issues when it comes to representing global south literature, particularly because of language barriers and other types of research access issues that can come about that. But again, I can easily talk about that to a great extent about that. But before I move on to the next thing, I do see a question. Are there resources through the library that can translate literature from other countries that speak languages other than English? That's actually a really good question. And unfortunately, pretty much the primary response is kind of no. and it's not necessarily because the library doesn't have anything to do, has anything to provide in that area. It's more the sense that there isn't really a reliable resource or tool available, like anywhere, that can reliably translate that type of literature. Like I kind of said, even if you have a translator who can translate in general, they may not have necessarily the knowledge to translate heavily jargoned terminology and even stuff that's specific to your field. And that's the same thing goes with most translation software. Basically, the most reliable type of software is arguably Google Translate. And if you ever use Google Translate, you probably know that it's not necessarily that reliable or that accurate. So yeah, there are issues with that. And I think that also comes into play of having a more inclusive and diverse research team or clinical team, especially with having linguistic diversity could be definitely a beneficial thing here. But again, depending on your resources and ability to do so, that can kind of depend. But yeah, that right now that would be kind of the ideal for that. Yes, right? Yeah, $1 million idea for sure. Yeah, I would love to see that. But yeah, so regarding back to these search strategies is also defining your approach to the literature search or just your general search of the evidence with health equity in mind. So essentially what I'm kind of talking about here is basically making sure that your goal for the search also includes questions about, are there social determinants of health? Are there, such as, like we were talking about, multiple identities happening, such as race, gender, and so on, that might influence the burden of a given disease? And how might the effects of an intervention differ for marginalized populations across race, gender, and socioeconomic status as opposed to more privileged populations? So in particular, whenever I kind of talk about this, even in when I first introduced students to the idea of doing a search, through the literature, even in evidence-informed practice 1, we often talk about PICO, right, as the preferred health sciences oriented search strategy for doing that. But what I like to emphasize a lot, and not necessarily talking about intersectionality with them, but I do like to incorporate the value that PICO can have with actually acknowledging differences in population demographics, because particularly with PICO, there is the P, which can stand for population problem patient, and that allows you to have that ability to identify relevant demographics when it comes to race, when it comes to gender, whatever might be relevant to your particular group, your community, your patient, and being able to represent that target population. Because oftentimes by doing a general search of the evidence, as we've kind of talked about, is that most of the time you're going to encounter a very homogeneous pool of information that's really kind of representing more predominantly of white male experiences and outcomes. And also, even with the O in PICO for outcome, that can also be a site where you can include or can at least consider health equity. Is it equitably treating, in terms of this intervention, the patients that you're seeking to address, or at least all patients, right? What are the differences being identified through that or being revealed? But yeah, and then with my next point here is applying an interdisciplinary approach to searching the evidence. So given that health disparities are products of social systems, or like systemic barriers, systemic costs that are preventing people from being able to access it based on a multitude of different identities that they have, whether it comes to like social class or socioeconomic access and race and all that. Your search for the evidence may extend beyond the domains of medicine, because you might be required to explore literature that more heavily focuses on those type of disparities. Particularly like if we were going to talk about the humanities and social behavioral sciences, even ethics and politics and culture. There are a lot of there's a lot of literature out there that speaks to those issues. Um, so it's always important to keep in mind those type of resources and tools that allow you to access it. Particularly when I was talking about scholarly databases and how, one of your preferred databases is PubMed, right? And like I said, it focuses specifically on medical and life sciences. But beyond that, it doesn't reveal a whole lot of literature beyond those domains. So the further you get away from those topics, the less you're going to find. And so it's important to consider other databases that might have more relevant information when it comes to these type of issues, these type of barriers. Um, Particularly like if we were going to talk about like, medical sociology, they definitely talk about these type of disparities. Um, but medical sociology is not necessarily a primary discipline that's talked about in PubMed, or at least in terms of your search results. Also keep in mind that other disciplines outside of the health sciences may be examining similar issues that you're looking into, at least in terms of health equity and intersectionality, but they may use different terminology, conceptual frameworks, and like I said, search tools to do that. So it's important to consider all alternatives to your search beyond, say, PubMed, and even I might even argue Search USA. Like I said, even though it allows you to search all of our database, or most of our databases simultaneously, it does not search all of them. Namely, ProQuest is one of the ones that gets left out, and not so much because we left it out as a library. It's because ProQuest and our service provider for Search USA, EBSCO, they're competing rivals. They don't like to really merge or integrate their resources all that much. So really, you're getting most of our databases through Search USA, but you might be missing out on relevant literature through ProQuest, which actually focuses more on a multidisciplinary approach to things, particularly merging of humanities and education and even the medical sciences together. So you probably will find more information there as well. Another really important point I like to make too is involving patients and communities in research and clinical decision making when you can. There might be certain cases where it's not as applicable, but ideally you want to involve them as much as possible, especially if they are marginalized voices in particular. Namely because, again, as we've kind of talked about, is that medical services and research practices, at least in Western countries, specifically like the United States, have not necessarily always been accessible, or they're not necessarily beneficial to certain marginalized populations, as we kind of talked about, as historical and even contemporary traumas of disempowerment, dehumanization, and oppression. And there's a whole bunch of examples that we could talk about, but that legacy of trauma continues to impact the lived experiences and health of various patients and communities and populations. So it's important to know that, as a practitioner and a researcher, those carry certain privileges that can influence that trauma, that can communicate it and shape it. So to address those type of institutionalized privileges that you might have is actively including your patients and their communities in the process, preferably at every stage. Again, it may not necessarily always be possible, but when you can, it's definitely preferred. For example, when addressing indigenous populations in the Americas, there are several key points to understand, one being that several tribal nations support their own institutional review boards, IRBs, and research data protocols. So it's important to respect those if you're working with indigenous communities. Another thing in particular too, especially if you're doing research, but you can even apply in the clinical setting, is that oral history is a very important methodology and tradition of knowledge among many indigenous communities. It's important to recognize that there is a long-standing history, though, of non-indigenous researchers misusing this knowledge at the cost of indigenous health, cultures, and sovereignty. So it's definitely important to consider your role in that, especially given the history of the health science professions and such. And again, that legacy. We can even talk about LGBTQIA plus communities having incredibly diverse health needs and perspectives that require a collaborative partnership with them to maximize the value of your work. Because even though LGBTQIA plus is the common umbrella term, the reality is that each letter in that acronym represents various intersections, various health needs, and various experiences. So they're not necessarily going to be all the same within those communities. So yeah, that's another important thing to consider as well. But yeah, and then last couple points here is incorporating intersectionality in the critical appraisal of evidence. Mainly, this is something that is kind of being slowly acknowledged more in the literature, and something that I was noticing as well is that a lot of the critical appraisal tools and methodologies that we use to assess the quality of evidence doesn't necessarily incorporate a really critical lens as to the sampling procedures as well as the population representations within that evidence. So like I said, even though like a lot of the research that we're accessing is fairly homogeneous, fairly white and male. So applying principles of asking yourself, is this evidence really representing different populations equitably? Maybe there's differences, maybe there's gaps, maybe there's contradictory information out there. And so it's important to incorporate that in your critical appraisal of evidence. And then the last point is assessing therapeutic interventions in the context of health equity. And basically, this is again just noting the fact that not all therapeutic interventions necessarily address population needs across race, gender, and so on the same. Our lived experiences are definitely different in different ways. One example I could cite, actually, in particular, is that there was research on how a common seizure medication, I forget the name of it, but it's a commonly used seizure medication, but apparently it's been more recently revealed of how it can actually have harmful and even fatal effects on certain Chinese populations in particular. And even though a lot of the pre-existing literature on it was more focused on like just a general population, but again, what was general about that population? What did that mean in terms of representation? Because later on these pieces of literature actually identified that certain groups were not benefiting from that and were actually being harmed as a result. But yeah, and there's plenty of other examples like that in terms of the inequities that are attached to certain therapeutic interventions that we may try to use more universally. So yeah. Is there any questions or comments or anything like that? Just to see, I know I talked a lot, so feel free. Yeah, I know. Not a lot of people know about the ProQuest thing because, it's one of the things that we really, at least I know on my end in terms of workshops with students when I first introduce them to the resources, I always try to emphasize, do not think that SearchUSA is your end-all be-all type of search engine, or treat it like you would as with Google. Like if there's nothing, everything you find on Google is everything that you're going to be able to find, right? Or and the same thing with SearchUSA. It's not going to be the only way you're going to see everything. So yeah, it's always important to kind of know the alternatives and know those type of systemic biases that can be attached to that. Because again, that's kind of a bias in the sense that, because EBSCO won't integrate ProQuest resources and vice versa, that, they're essentially creating a gap that not necessarily is visible. But yeah, with that, actually talking about resources and knowing your alternatives, I was actually going to move into my last part of my thing here. For the sake of time, I probably won't be able to give as much of a full demonstration of each of these resources, but I'm hoping to at least kind of cover these to some extent, and I can easily link you to where I actually provide a list to all of them, just in case you want to share with your students or just have them in general. But yeah, there's several health equity tools that I've kind of identified that can definitely support your evidence-based practice, especially within the context of intersectionality. One of the things I do want to stress though with any of these resources, again, they're not one-all be-all type of resources. And more importantly too, is that even though we talk about intersectionality right now, the problem is that most of these resources don't necessarily apply the principles of intersectionality. Typically, you'll find that even ones that do talk about some sort of health equity, they tend to focus on specific populations, namely like BIPOC, Black, Indigenous, people of color, or they might more focus on LGBTQI plus populations or language barriers and so on. So it's important just you as the practitioner or as the researcher that you can apply those principles to intersectionality in your practice by combining these resources or using them appropriately in pursuit of that, right? So yeah, so the first thing I wanted to cover was MedlinePlus. This is actually a really great resource that was developed by the National Library of Medicine. Particularly, they have a bunch of evidence-based information on a variety of health topics, drugs, and supplements, and more. But one in particular I like to address is population groups. They actually do have a lot of evidence-based information regarding, say, like American Indian and Alaska Native health. I'll actually put it into the chat. That way you can actually see it with me if you would like to. But yeah, I mean, you can definitely see like Asian American health, and you can actually see some summaries, some specifics, and statistics and research and clinical trials. So again, these are all kind of based on the evidence. So they're all, you know, regularly updated as well. And I figure this is actually a really good resource, especially for students who are on field work, who need just a quick access, like in those like kind of in the clinic settings, you know, where they don't really have time to do a comprehensive search through the databases, because really databases are more built towards research purposes. They're more for your comprehensive searching of the literature rather than specifically identifying, you know, those high quality points of evidence to inform your practice, right? That you may not have time for or just are otherwise limited to. So it's a really great resource in that way. Yeah, and yeah, they again kind of have a bunch of different types of populations covered here, even like men's health, Latino, Native Hawaiian and Pacific Islanders. So anything that you kind of need, LGBTQ plus, and so on. So it's really great. And then the next one I like to cover, I really like this resource in particular, is EthnoMed, which is a fantastic resource if you are working with refugees, you're working with immigrants, you're working with you know, just people of color in general. Basically, this is a way of integrating, as it says, integrating cultural information into your clinical practice, because there are definitely going to be some cultural differences that you might encounter. And this has a really good way of introducing those type of topics. Particularly, you know, it's organized across a variety of different health-related topics. Or you can even identify by cultures, so it has several to work from. So if I were to want to look into Vietnamese, it'll give like a cultural profile, so you get some more background information to be considerate of. You can even talk about religious beliefs, you can talk about death and how that's handled, traditional medical practices, and their experiences with Western medicine in particular. So anything that's relevant there. So it even has more information for providers in terms of other resources and even for patients in particular. Actually, one of the great things about EthnoMed is it also can be a site for patient education, because they actually do have resources where you can have translated patient education handouts for different types of conditions, which is really great. And you can even do the same with MedlinePlus. It actually does have a really good array of different patient education handouts that can be translated across different types of languages. Yeah, and then, sorry, I'm going a little fast on these, but just for the sake of time, really. But again, we can easily revisit these in another time, or you can easily consult with me personally. This is one of my favorite topics to talk about. So. But yeah, DiversityRx, very similar to EthnoMed. It basically has a lot of topics on cultural competency, particularly in terms of care and training and language access. So it provides a lot of different resources. I mainly use this more as almost a database in itself. It's not really necessarily a database, but it has a bunch of listings of different types of resources across language, counseling, anything like that. So it's really great on that end. I'll also provide that in the chat as well. There we go. Yeah, one of the other things that I like to highlight is more research-oriented tools, but these can easily be used for clinic settings, depending on what you need. But I also want to highlight, in terms of informing your own research. So particularly the University of New Mexico Health Sciences, particularly their library, developed a native health database, which they're always constantly expanding on, that basically looks into, as it says, native health. So I'll link this in the chat as well, just in case you want to do a little search for it yourself. But yeah, essentially they have a bunch of different literature that you can find on various topics regarding indigenous populations when it comes to like mental health, diabetes, substance abuse, teen suicide, obesity, and traditional medicine were a lot of their more popular topics that they looked into. You can even do a map search, which is kind of neat. I wish this was kind of more like applicable. Or at least a little bit more used in other databases where you can actually see articles that were specifically mentioning certain populations, depending on their state and everything like that. This is particularly important for Native health in particular because not all Native indigenous communities have the same needs, have the same expectations or perspectives towards health. Yeah, so question, have you explored the culturally competent trainings and do you think they would be appropriate for our OT students? I think they would definitely be appropriate, probably in some ways. I think it would apply to a more general focus on healthcare and medicine. So some of them may not be as readily applicable, but I definitely think they could be, especially anything to do with occupation oriented type of subjects and so on. Yeah, but if I'm assuming you're probably talking about the DiversityRx, but yeah, definitely. I definitely think they could be readily applicable in terms of clinical interactions, patient education, stuff like that, mental health and substance abuse, which I know is definitely an important topic in OT. So yeah. Yeah, so another really great resource, man, I feel bad for fast forwarding through these, but it's okay, is lgbtdata.com, which is actually an open access clearinghouse that includes a lot of different data points on LGBTQIA health information as a way of kind of helping with informing your practice. And also you can use a lot of these different types of data points, particularly like surveys and such, for your own research if you were doing like secondary analysis or something like that. You can even assign your students maybe to look into one of them. But yeah, it even has more knowledge on different types of topics here. One of the really great things I like too is the different measures that it actually talks about. Even though it doesn't necessarily have the actual assessments themselves, it depends on like paywalls or you have to contact the author in particular who created the measure, anything like that. So, but they do give you more information about each one. And yeah, again, sometimes it even just gives you the actual thing. Or if you need more information, you can contact them, probably using that article. Sampling methods are actually pretty good. They actually provide some talks about population and sampling of like LGBTQ populations and just general populations in general. But yeah, it's a really great source. I'll link it to the chat really quick. But yeah, and speaking of measures for LGBTQ IA plus communities, there's actually a database that is fully dedicated to that. So I'll link it to the chat again in case you're kind of curious about it. But yeah, essentially this is they call it a one-stop shopping like place for researchers who are seeking measures that specifically uh, assess issues for lesbian, gay, bisexual, and trans populations. So yeah, you can browse through a bunch of different types of uh, scales and measures and assessment tools. So, and mainly they're kind of more focused on mental health in particular, or just like identity type of components as well. But there's plenty of other ones that relate to like stress or other types of issues that might come about. So let's see. So if I were to like, select one, say I was just really interested and I want to know more information about it, you just check box the ones you are interested in. And then at the end, press submit. And it'll essentially give you kind of like an abstract of each one. And it'll actually tell you where it originally came from, the reliability and validity, which is actually really useful. Sometimes it'll even give you a download option for the actual assessment itself. It's not always guaranteed it'll have that. If it doesn't, it'll often provide you the author contact information, which is actually really nice. So you can ask for permission, which a lot of authors are particularly willing to do so, especially if it's for clinical reasons. So yeah, that's definitely something to consider. But it looks like, yeah, they even provide a Word document version of it. So it's pretty nice. But yeah. Again, this one also kind of grows a lot too, in addition to like the native health database. So they're going to be smaller databases in particular. You might notice that like the native health database is kind of small. The reason being is one, it's kind of independently constructed by that university's library, and two, it's also speaking to the representation of indigenous needs in research. It can also just speak to the underrepresentation that comes about from that. But yeah, I find these are really great tools in general. Last couple, if you'd like to stay on for just a couple more minutes, I won't take any more of your time beyond that, but Racial Equity Tools is a really great resource. I typically use this one, if you were to use it, more as a way of generally understanding racial equity. Particularly what I really like, and one of the faculty I actually talked to about this particular resource really liked, was the glossary. That way, if you are really introducing yourself to issues of social inequity, of social justice, and particularly when it comes to like critical race theory, intersectionality, and so on, it'll actually provide you definitions to actually look into and provide sources of them. And it's a really great way of like really orienting yourself, especially if you're kind of new to this or need to brush up on certain topics. It's really great, or like anti-racism and such. But it also has really great ways of like talking about the history of racism, kind of giving that contextualization, demographics and population data as well, which is really neat. So it'll link out to a bunch of different demographic sources regarding like statistics on Native Americans and so on. So it's not necessarily like the most health-oriented focus, but they do talk a lot about health. But it's more holistic in the sense of like education and other types of sites of issues. Particularly like, yeah, like as it shows here is that there's a bunch of different ones of like trauma, violence and healing, media and technology, food justice, health and healthcare. So you might see more topics about that. And a more like analysis and research, community resources, definitely ones of relevance. So I like it a lot. For really kind of just orienting yourself and your research and your clinical practice towards that end of health equity, particularly in terms of racial disparities. Yeah, last couple ones I wanted to mention here is the FAIR database. This one's actually really useful because it operates much like the Native Health database, but it's more inclusive of other racial and ethnic diversities. Particularly, you can find information about American Indian, Asian, African American. You can sort out by different types of strategies that are mentioned here, engaging the community, cultural issues, health literacy screenings, other types of topics as they kind of relate. So yeah, it's a really, and like disease area, it's a really great way. So you can easily locate a lot of these. One thing to mention with the Native Health and the FAIR database is that the full text is not necessarily guaranteed, but you'll probably find a lot of information about this, and you can really just copy and paste the title and search it through Search USA or through ProQuest and see if we have full text access to it. If there's any questions or anything like that, I'm happy to answer any. But yeah, thank you so much for sticking around, for attending this. I really love this topic, and I always like to continue developing it further. So yeah, I always appreciate it.